What's your biggest obstacle?
Definitely is to do with two things really: perceptions of private dentistry and fear. Those are the two biggest obstacles from a consumer point of view. So, as I said, you break down fear just by proving to them that they don't need to be fearful. I think that people's perception of private dentistry is that it's going to be hideously expensive. It's not for me, in other words. I don't belong in that club. I belong in the NHS club, even though I might not be able to access the NHS club because there's no spaces in it, or because it's too inconvenient and I can't get in. So there's that vast majority of people walk into our practice and say, the first thing they will say is, are you an NHS practice? And so your next conversation is, this is what we are. We're not, this is what we are, and this is how we work. And then they can get their heads around that. But it's very much breaking down that perception of what private practice represents. And I think also in this country we do a big disservice to our patients in that many of them access a dentist, they come in as an NHS patient, and then they seem to leave as a private one, and they can't quite work out what happened in the middle. So I come in and somebody talks to me about, I've got no quota to do that particular root canal, so you can have it privately or you can wait till next February. And they go, what does that mean? So they go, oh, okay, they have it done. And then they're looking at this whacking bill saying, hang on a second, if I came last month it was that, but now I come this month it's this? How does that work? And I do think that some practices use the NHS as a marketing tool. I think that's what they do. So they put taking patients now, and that brings lots of people in thinking, great NHS, but before too long they're bounced into something that they had no idea they were signing up to. And I think that does the industry a tremendous disservice, and it's cynical patient management in my view, and it will kick people very firmly in the wrong place if it is allowed to continue.
Should established private practitioners be worried if a CFD clinic opens in their local Sainsbury's?
Not at all. If they're doing a fantastic job, if everything's working well for them and they're looking after their patients, why on earth would their patients want to come to me? So I would say absolutely not, don't worry at all. If you're not doing a great job, if you're not looking after your patients as well as you could, then you might lose some of your patients to me. I have one practice, which won't be named, where we were having patients come into us on a Sunday saying that their local private practice on their answer phone was saying, if you have an emergency on Sundays, go to Sainsbury's. So I will never, ever, ever steal a patient, ever. But if you send them my way, then I will do my very best to hold on to them. And for me, it's a bit like having a Lamborghini and leaving it on the street with the engine running, the keys in, the doors open, and a sign saying, help yourself, because I couldn't be bothered to put it in the garage overnight.